The Department of Health now ranks Philippines as one of the countries that has the fastest growing HIV epidemic in the world with a prevalence rate of 5% nationwide. There is a 20 to 25% prevalence rate in Metro Manila and 15 to 20% prevalence rate in Cebu. This rate dwarfed the prevalence rate in South Africa, which has the largest population of HIV-positive individuals in the world, with a mere 4.7%. Prevalence rate refers to the percentage of individual affected by the disease at specific time. With that in mind, we can say that right now, in a population of 110 million Filipinos, there are 5.5 million individuals currently living with HIV. Mere 5 years ago when I started making this blog, the Philippines is a low-prevalence country with less than 1% of the population affected by HIV. This rapidly growing epidemic, if left uncontrolled, will eventually make the Philippines at par with South Africa with 1 out of 10 individuals affected with HIV. So what went wrong? As a nurse with 15 years experience handling HIV cases and working actively with HIV-positive individuals, here are my personal conclusions. Do take note that these conclusions are not even close with the official conclusion of the Department of Health on why HIV became a rapidly growing epidemic in the Philippines. I personally think that their conclusion is too traditional and not in touch with the modern activities of our youth. Doe says that the resistance of the Church to some forms of birth control is a contributing factor on the HIV epidemic right now. I say that HIV is most commonly seen in the young population. A population that makes their own decision and is rebellious to the Church teachings. Though the Church could have caused some sort of contribution, I do believe that the lack of sex education in our school, particularly to our youth, is a more blamable culprit than the Church. Did you know that people ages 14 to 30 makes up the 95% of newly diagnosed HIV cases each month, and the median age of affected individual for the last 5 years is just 28 years old? Doe says prostitution or sex for money is a contributing factor of the epidemic and should be eradicated. I say that prostitution cannot be eradicated. Since the dawn of human civilization, there is prostitution, and it is something that is very hard to control, much less eradicated from our society. What Doe can do is to provide an ID system and free monthly checkup to our sex workers to protect them as well as the people that they serve. This will also encourage the client to only have sex with a clean sex worker. This will also further educate our sex workers on proper ways of protecting themselves from different sexually transmitted infection as well as unwanted pregnancy. Doe says that persons under 18 who wants to test for HIV should require parental consent. I say that, I have clients with HIV at age 13, 14, 15, and that is because of failure in health promotion. The accessibility of casual sex through apps like Grindr and other dating apps makes it very easy for two complete strangers to have sex consensually, and thus, spreading the virus like wildfire to our young and techie population. These individuals would never dare to ask their parents' permission to go with them and get tested. Our culture against premarital sex and our bigotry against the LGBT makes it impossible to do so. HIV testing should be accessible to anyone at any age on their own volition. How to get tested? HIV testing in the Philippines. One of the most important thing to do to prevent transmission is knowing your status. HIV is a very controllable disease as long as it is detected early and has not yet done major damage to your organs, most especially the liver, kidneys and the brain. There are many ways of getting tested for HIV in the Philippines. We will discuss each of them, one by one, including their advantages and disadvantages. Hospitals. Testing by going to hospitals is one of the most common means of getting tested. There are 5 hospitals in our country that specializes with HIV counseling and testing as well as referrals in case you tested positive and needing further treatment. In no particular order, RITM, San Lazaro Hospital, St. Luke's Medical Center both in Quezon City and Global, Makati Medical Center and Medical City in Ortigas. Do take note that the cost for HIV testing is around 1,100 to 3,800 in the private hospitals I mentioned. Pros: if done correctly, results are very accurate. This is also the only results acknowledged in various employment and immigration requirements. Cons: there is always an issue with regards to privacy and confidentiality getting tested in any hospital. Though privacy is protected by our healthcare professionals, there are many incidents of information leakage caused by poor protocol with regards to transfer of information, such as students getting free access to medical records without permission or a slip of tongue during a conversation of one of the member of the healthcare team handling the HIV case. Hacking is another risk when it comes to electronically stored medical information and records of medication being dispensed from the pharmacy and to whom. When it comes to public hospitals, though uncommon, there are recorded cases of results being switched between patients. It is not unheard of that a certain person tested positive, though in reality, he is negative simply because a specimen sample was incorrectly labeled with his name. Lapse in judgment and concentration of our overworked and underpaid medical professionals is the main culprit in most cases. 2. Free tests done by volunteer groups. We have friendly, volunteer groups that do testing for free. You can call them and schedule a visit and let them know that you are interested in getting tested. Love Yourself Malate Hub #1850 Leon Guinto Street, Malate, Manila. Contact 353-8922. Love Yourself Anglo Hub Unit 5, 3F, Anglo Building, number 715A Shaw Boulevard, Mandaluyong City. Contact 0915-366-5683. Pros, free, and they offer counseling as well. Staff are very friendly, professional and trained. Cons, privacy and result confidentiality are concerns when it comes to free and public testing. Though trained, innocent conversations could lead to information leakage both consciously and unconsciously. There are cases wherein a volunteer saw a recently positive patient in the mall and told his friend that that guy's just tested positive yesterday. 3. HIV testing kits. Testing kits are widely used as the main method in HIV detection in some hospitals and hygiene clinic. All free testing done by volunteer groups uses HIV test kits. HIV testing hubs also uses HIV kits. Medical missions and workplace testing will usually use HIV testing kits. They are easy to use with result at 99.9% accuracy seen in mere 10 minutes. The common brands in the Philippines are Fujibio and SD Bio. Fujibio is Japanese made while SD Bio is Korean made. Both should give an accurate result with 99.9% certainty similar to that of hospital-based testing. Only Fujibio HIV test kits are the only one you can buy online. Pros, very easy to use and results are very accurate. I would personally recommend testing using test kits first as to give you an accurate idea of your status before going to the hospital. That way, you will know that you will test negative or positive in advance privately. It is also very convenient and you are assured that only you will know the result. Fujibio HIV test kits being sold online also offers free counseling. Cons, since the person that bought the kit will usually test himself or herself, anxiety could lead to testing delay. Some people will contemplate for weeks before using the test kits and then eventually forgets that he bought one. Tested positive. What should I do next? If you used any of my recommendations above in getting tested and you tested positive, do not despair. HIV is a very controllable disease and achievement of undetectable viral load is the treatment goal. Living a normal life is very possible with HIV as long as treatment is started and adherence to the treatment regimen is established. We have two options in getting treated. Research Institute for Tropical Medicine RITM is the premier and the leading facility in the Philippines when it comes to antiretroviral drug distribution as well as treatment for HIV patients. This should be your first choice in obtaining confirmatory results and further treatment if the initial testing result was positive. RITM is more specialized than San Lazaro and could deal with serious HIV-related complications such as Mycobacterium bovis infection as well as cryptococcal infection of the brain.